Well, companies looking to ways to lower the cost of healthcare by improving the wellness of their employees, what they're doing and how they're doing it with big data. The Wall Street Journal reporting Walmart, for example, is looking to identify whether workers are at risk for certain diseases. The retailer hired Castlight Health to do just that. Senior Vice President of Health Plan Development at Castlight, Kristin Torres Mowat, is with us this morning. Kristin, it is good to see you. Thanks so much for joining us.
Good morning. Thank you.
You should have been here last segment. We were talking about Obamacare. And, you know, I see that employers spend $620 billion on health care a year. 30% of those dollars are wasted?
That's right.
Yeah.
Those 30% of wasted dollars go to care that could be avoided, go to care that takes place in the wrong setting at the wrong time. People who don't get the right preventive care on time end up having to go to the emergency room. We know that 73% of people don't know what benefits they get from their employers.
Do you guys know what benefits that you get from your employer?
Yes, very well.
Yes.
Very well. Well, I try to. Most people. You say, Kristin, most people don't.
Most people
and I think you're right about that. I got to tell you.
Maximizing my benefits.
I cannot say that I know all the benefits that I have.
I agree.
Because
yeah, me too.
I
Same.
sign up in October for something, and you know, I remember the big things, but come June, I don't remember exactly whether my employer has the second opinion program that I should consult with before going to a specific physician.
So how does Castlight educate us on what we have? Tell us about action.
Well, here's what we do. So we're on a mission to empower people to make the right decisions for their health and organizations to optimize their healthcare benefits. And our product Action, which we just launched end of last year, and we have customers on it live beginning of this year, is doing just that. It is providing relevant and timely information to populations that need to know about their healthcare benefits.
But you go further. You can literally look, and you do it anonymously. You're
That's right.
looking at someone's health history and predicting for companies who might get sick, so the companies can then try to direct them. If somebody's overweight, and you can correct me if I'm wrong, but if they're overweight and maybe at risk for diabetes, the company can try and get them in some sort of like weight loss health program.
Well, a couple of things. So you're right. It is all of our work is done on an aggregated and anonymous basis. And then the message, any relevant or timely messaging that we direct to people comes from Castlight, not the employer. And so it is impossible for the employer at any point to know anything about any employee at all. All they know is just large information about segments of their population.
All right, and I just want to get a clarity on the privacy aspect of this, because you're talking about
Which is why you anonymize it.
medical
That's right.
data. So you anonymize it, you have this big data, then you communicate with the individual?
We communicate with the individual, but they're messages that are made for population. So let's take the example of back pain. If I search for back pain.
You say 40% of all back surgeries are unnecessary?
Wow.
Yes, and 30% of those back surgeries result in complications that result in readmissions. And some people, let's just take John Smith. He might have back pain and think, well, my neighbor ended up having surgery, so I'm going to avoid a year of physical therapy and visits, and I'm going to go straight to a back surgeon. Well, that might not be right for him in this case, and what's better, knowing that he doesn't have any prior history, he's otherwise healthy, sending him a relevant message that says, did you know about the benefits of physical therapy? Or did you know that your company covers chiropractic care?
Yeah.
That avoids an unnecessary
A decent
surgery.
surgeon would say this is what you need to do first before you go see a surgeon.
Right, last
orthopedic
resort.
surgeons would do, like good doctors would send you to the starting line and not the finish line. So
But you shouldn't have to go to that surgeon in the first place.
right.
Yeah, it's a good point. Kristin, good to see you. Thanks so much
Thank you.
for joining
Wonderful to
us.
be here. Thank you.
Appreciate it very much. Kristin Torres Mowat there.